Hello, so for my BADM 350 final project, I chose to do a business briefing on telehealth. What is telehealth? So according to the Mayo Clinic, telehealth is the use of digital information and communication technologies such as computers and mobile devices to access healthcare services remotely and manage your healthcare. So telehealth really benefits those living in rural areas who don't really have accessible healthcare providers in their area. It also benefits those who have limited mobility, um, who can't really, get out of their house and visit a physician that easily. And it also benefits those just looking for a more convenient option to get medical advice from a licensed physician. So, what are the different types of forms of telehealth? Telehealth can come in the form of an electronic health record, which is like a digital record of your medical history, uh, record of visit summaries, immunizations, lab reports, just your medical information. And then there's also the patient portal, which is like an app. MyChart is an example of a patient portal where patients can easily message their physician, ask for prescription refills, review old lab results, um, and past visit summaries. And telehealth can also come in the form of telemedicine, and telemedicine is just online consultations with a physician. Doesn't have to be your family physician. Um, the center picture is an example of a telemedicine visit where it's just the same thing as a doctor's visit, but the doctor isn't in the same physical location as you. They're probably being Skyped or webcammed in. And then personal healthcare apps are also examples of telehealth. So your MyFitnessPals and your Apple Health, those are Apple Health apps. Those are examples of telehealth. So categories of telehealth, we have telemedicine, telenursing, telerehabilitation, telesurgery, telepsychiatry, telecardiology. These are only a few examples. Telehealth and telemedicine can be applied to all sorts of disciplines of healthcare. These are among the most popular ones. So, telenursing on your top left corner, you'll have an example of telenursing. And that's basically online webcam consultation with a nurse. Telenursing can also come in the form of a nurse hotline. So I know McKinley Health Center has a service called Dial a Nurse where you can dial a number and a nurse will pick up 24/7 and you can ask that nurse medical advice. And then there's also telerehabilitation. Telerehabilitation is really helpful for those who have limited mobility. So you can get telerehabilitation consultation in the comfort of your own home. Telesurgery is where the surgeon is not in the same physical location as you. So the surgeon is in like a different location and they're controlling robots which perform the surgery on you. That's a growing field as well. Telepsychiatry, telecardiology, all these telemedicine fields have generally the same theme of where the physician, surgeon, doctor is not in the same physical location as you. Instead, they're remotely monitoring or managing your healthcare via like consultation, surgery, that type of stuff. And then so big telehealth firms are in the health IT field. There's Epic and Cerner. These are the two um, biggest health information and electronic health record companies. I think Epic is in the U.S. News and World Report, all of the top 200, all of the top 20 hospitals. So they're really popular. Cerner accounts for, I think, 27 of all inpatient electronic health record systems. So these two account for over 50% of all electronic health records utilized by hospitals in the United States. Telemedicine wise, we have firms like CyberMed, GlobalMed, InTouch Health, and Doctors on Demand or Doctor on Demand. These all provide um, online consultations with physicians. Global Med actually creates the devices in which doctors can, easily interact with the patients through like computers and webcams, that type of stuff. Interesting fact: Doctor on Demand was actually founded by Dr. Phil. So back to like telepsychiatry, Doctors on Demand. Doctor on Demand offers mental health support and telepsychiatry services. And that's really cool. So, what are the challenges of telehealth in the future? Coverage and reimbursement are huge issues when it comes to telehealth. As of now, 31 states, including the District of Columbia, have parity laws, which require private commercial insurers to cover for telehealth services. So, working towards those other 29 states, or 19 states, I should say, in making sure that all private health insurers are able to cover for telehealth services. That's something to work towards. Also, interstate licensing laws. So, in the United States, if a physician in order to provide telehealth services, they need to have license. Need to have licensing in the state where the patient is physically located. So if the physician practices out of Illinois and wants to provide medical or telehealth services with a patient living in Iowa, that physician needs to have licensing in Iowa as well. So um, that type of stuff really is a roadblock in furthering telehealth. But there's also interstate licensing. You can get like an interstate license where it makes it easier for physicians to practice in a variety of states. Also, data security. So as more and more people utilize telehealth services, data security becomes a bigger issue for health systems, telehealth firms, um, private insurers, those type of firms. And future of telehealth, policy change is definitely in the books with the rate that telehealth technological advancements are headed. Policy needs to follow up. Value-based care. So right now it's really a direct-to-consumer business model. Changing it so that value-based care is really taken into account, looking at hospital readmissions, um, quality, the cost, looking at reimbursement based on what level of treatment is given to the patient. That's something to be aware of. 5G cellular mobile communication, which sounds crazy, but that's something that will certainly change the delivery of telehealth services, the quality of telehealth services, and the reputation as well. That's something to look forward to and just be excited for in general. And AI, AI is like the panacea for all problems, regardless of whether or not they're technologically related or not. But AI is something that health or telehealth firms and telehealth stakeholders are looking to utilize, but also be wary of because AI has the potential to really help out telehealth firms, but also has the potential to worsen uh, health disparities, which is a growing issue in the United States. And lastly, my references. I know I threw a lot of cool pictures in there, so in case you wanted to know where I pulled the pictures from, check these sites out. All right. So thanks for listening. Thank you for your time. Um, Hope you learned a lot about telehealth.